The legislation aims to get a national public insurance plan for pharmaceuticals off the ground, starting with contraceptives and diabetes medication. But the bill itself is short on details. It's less than 6 pages long, leaving much of the system to be devised now after it's passed. Even though pharmacare is officially law, it won't become a reality unless the provinces sign on.
This is real progress, but now we need the provinces and territories to come to the table.
Provincial governments can now start cutting deals with Ottawa for coverage, and the health minister is hopeful to have all jurisdictions on board by the spring.
I think it would be ideal if we could all get onto the same page. That's certainly where we want to go, but we need evidence to inform that, and we need a lot more conversations.
There's not much clarity in the bill over how the new public option will affect private drug plans, which could drop coverage in these categories.
Put yourself in the headspace of an employer who today picks up the paper and sees that the federal government have now announced they're going to cover diabetes medications for Canadians for free. You're going to say to yourself, why should I continue to cover those drugs?
The insurance industry thinks the better approach is to target those who need help, as the government did with dental care.
For a portion of people, they will lose access to those medications.
Honestly, I can't think of a circumstance where a patient is accessing a medication that I'm prescribing under a private plan that suddenly wouldn't be available under a public plan, or where there's not at least a suitable substitute or alternative.
This family doctor says a trip to the pharmacy should be like a trip to the doctor's office, free at the point of service and accessible to everyone.
If we're interested in building one of the best models of drug coverage in the world, and we're interested in learning from other countries, then the best model is a universal public single-payer program.
The new law also calls on a committee of experts to deliver recommendations within a year on next steps in establishing a full-fledged national universal single-payer program. That means that report would be landing around the same time as the next federal election. For City News, I'm Caryn Ceolin.